Hi, everyone, and welcome back to NurseEdScholar. We've covered asthma, COPD, and today we're going to close it out this mini series with pneumonia. So, unlike asthma and COPD, which are chronic conditions, pneumonia is an acute infection of the lungs, and it's one that you'll see a lot in nursing practice. So, let's dive in. So, what is pneumonia? Okay, pneumonia is an infection of the lung tissue that causes inflammation in the alveoli. And those are those little air sacs where gas exchange occurs. Now, normally oxygen moves into the blood and carbon dioxide moves out. But in pneumonia, the alveoli fill up with fluid, pus, cellular debris, and that means that gas exchange is impaired, it's compromised, leading to hypoxemia, which, if you remember, is low oxygen levels in the blood. And also remember, when there's hypoxemia, the body doesn't know what to do. It's like, hey, I need more oxygen. So it creates more red blood cells called polycythemia. So remember that. All right, so let's move on to causes and types. So, pneumonia may be either infectious or non infectious. It can be caused by bacteria like Streptococcus pneumoniae, which is the most common, viruses like influenza, the flu, uh, fungi can cause pneumonia in immunocompromised patients, and even aspiration of food, fluids, gastric contents. So when you're in the hospital and a patient's getting tube feeding, um, or if someone is, nasal gastric tube feeding, they always say make sure you elevate the head of the bed, because if they lie back, if there's, anything that can happen, and the food can go into the lungs. Also, you know, you want to make sure, that's why they have those swallow studies, because, if someone had a stroke, you want to make sure that they can chew and swallow properly, and that food doesn't go into the lungs because it can cause pneumonia. Um, you'll also hear about community acquired versus hospital acquired pneumonia, and that basically just means, where did the infection start? There are, if you're at home, then of course it's community acquired, but sometimes pneumonia can happen in the hospital, and sometimes, I'm not saying all, but sometimes it is because of aspiration. So that's why you'll see aspiration precautions in some of your patients' rooms, because of course if they aspirate content, it can cause pneumonia, or this infection. And so, and sometimes another thing is that if it occurs in the hospital, it has a tendency to be more resistant to antibiotics. So that's why, we really try our best to prevent any kind of hospital acquired infection. And you'll hear a lot about that in, when you start working in practice, you'll hear a lot about that as well. All right, let's move on. So, pathophysiology. So, what happens? What's happening inside of the lungs with pneumonia? So, first, the pathogen enters the alveoli. It's either inhaled, aspirated, spread from the bloodstream. And so then when it gets into the lungs, it gives this appearance of consolidation, usually in one lobe of the lungs. Then, so after the pathogen enters the alveoli, then the body's immune response starts. And, it responds to this pathogen, and it starts sending white blood cells like neutrophils to fight the infection. Then the immune response causes inflammation, and the alveoli fill with fluid and pus and debris. And as the alveoli fill, gas exchange decreases. Oxygen levels drop, carbon dioxide starts to build up. Person can develop respiratory acidosis. So the result is person has shortness of breath or dyspnea, hypoxemia, fever, productive cough, which are all hallmark signs of pneumonia. So looking at the big picture, the infection causes inflammation, which causes fluid-filled alveoli, which impairs gas exchange. Okay, so how would this patient present clinically? They'll have fever and chills, cough, often productive. The sputum can be purulent, so kind of like pus looking, greenish tinge maybe, or rust colored. Dyspnea, shortness of breath. They may be cyanotic because with hypoxemia you'll start having that bluish tinge, which is called cyanosis. Chest pain with breathing, coughing. On auscultation, you may hear crackles because of that fluid build up, diminished breath sounds. Um, they may have some fatigue, weakness, um, and the hypoxemia may proceed to apnea due to respiratory collapse. So this is why, when a person has pneumonia, we really need to jump on it, educate on antibiotic therapy to eradicate that bacteria. And then also while you're in the hospital, because now we know that pneumonia can be caused by aspiration, we have to be diligent about those aspiration precautions to make sure that that this doesn't occur with our patients while we're taking care of them. So, as nurses, what are the considerations in patient care? So, you'll see orders for diagnostic tests such as chest x rays, um, CAT scans, sputum, gram stain, sputum cultures, and sensitivity, a CBC with a white blood cell differential, pulse oximetry, and ABGs, arterial blood gases. We'll also be assessing our patient's respiratory status, of course. We're going to be looking at their breathing rate, oxygen saturation, lung sounds. We're going to give oxygen if needed. Um, for hypoxemia, we talked about the fluid accumulation in those airways and it causes gas exchange problems. So we're going to have to give oxygen. We're going to give prescribed antibiotics promptly for bacterial infections. So a patient will be started on IV antibiotics while in the hospital, and then they may continue antibiotics on their way home. And that's where we're going to have to really educate our patients on making sure that you complete the regimen. And that's on any infection because, if the patient starts on antibiotics and they don't complete them, then all of the bacteria may not be eradicated. All of the bacteria may not be killed off. And then they'll multiply. So sometimes if you'll hear a person say, they've been discharged with antibiotics and then a week later they're sick again. And then you ask them, first thing you ask them is, did you take all the antibiotics? And usually they'll say no. And so this is where that education piece that nurses do. That's why it's so important. We want to encourage deep breathing, coughing, use of that incentive spirometer to get those lungs open and mobilize secretions, get them out of there. Ensure hydration to thin the mucus. So when we're coughing, they can actually cough up that mucus out of the respiratory tract. We're going to provide education, like I just said, antibiotic therapy, why it's so important, infection precautions, and vaccinations like pneumococcal and flu vaccines. We're going to monitor vital signs, administer antipyretics like ibuprofen, acetaminophen, um, and we're going to do measures to reduce patients' work of breathing. So positioning, we talked before about if a patient lies flat, we want to sit them up because that body weight will make it harder for a person to breathe and expand their lungs to get a good breath of air. So we're going to, do a lot of positioning techniques. And I don't know, I said a lot in a real short period of time, but that's it. That's your simplified breakdown of pneumonia for nursing students. And pneumonia is an infection that inflames the alveoli, fills them up with fluid, and disrupts gas exchange, leading to the classic symptoms that we see at the bedside. And that wraps up our respiratory mini series of asthma, COPD, and pneumonia. And together, these cover most of the common respiratory conditions that you'll see on exams and in clinical. So, and if you've been watching the whole series, please make sure that you subscribe. I post nursing, study videos every week, and to kind of, I want to help you succeed. And so that's really it. Thanks for watching Nurse Ed Scholar, and I'll see you in the next lesson. Bye.